Direct laryngoscopy, or DL, is the use of a device to mechanically clear a visual path between the operator and the patient's vocal cords. Direct laryngoscopy is either the bread and butter or the old school method of intubating, depending on who you talk to. At least for the time being, direct laryngoscopy is still alive and a necessary skill for emergency physicians. The two main devices used in DL are the Macintosh blade and the Miller blade. The Macintosh blade is curved, which some people remember by the curve in the blade matching the curve in the C of its name. The Miller blade is a straight blade, which some people remember because the straightness of the blade matches the two straight L's in its name. These are the two main devices used for direct laryngoscopy, though a few other less common blades exist as well. The technique for the Macintosh blade after scissoring open the jaw is to sweep the tongue to the left and walk the tip of the blade down the back of the tongue to visualize the epiglottis as the big flap hanging from the top of the mouth. Once the epiglottis is in sight, the tip is advanced into the vallecula, which is the recess where the tongue meets the base of the epiglottis. Snugly seating the blade in the vallecula is absolutely crucial to controlling the soft tissues of the neck, so be sure to get the blade deep enough. Once the blade is snugly seated in the vallecula, lift toward the opposite wall where it meets the ceiling. This is upward and outward relative to the operator. It can be tempting to rock the blade back and attempt to get a better view, but this should be absolutely avoided due to the likelihood of damaging the patient's teeth. Using the upward and outward force described, the epiglottis and soft tissues will pull up out of the way and allow visualization of the vocal cords. If the tissues aren't coming up with this force, there are many things to troubleshoot, but a good first start is to ensure that the blade is actually seated in the vallecula. If the blade is too shallow, you'll just be pushing around the tongue and the epiglottis will still be in your way, so be sure it's really in there. Finer points of troubleshooting direct laryngoscopy, including repositioning and external laryngeal manipulation, will be discussed later in the technique videos. Most people reach for a Mac blade first in adults, usually a size 3 or 4. With the Miller blade, the same initial insertion technique is used. After the jaw is scissored open and the tongue is swept to the left, the tip is walked down the tongue to visualize the epiglottis. At this point, the blade positioning will be something like this, with the blade just shallow to the epiglottis and above the vallecula. With the Miller blade, instead of tracking into the vallecula, the blade is slid further past the epiglottis with a small scooping motion in order to pin it up against the anterior airway structures. With the same upward and outward lifting motion described previously, displace the epiglottis and anterior airway structures in order to visualize the larynx. Here you see the epiglottis, which is then scooped past and pinned up with the tip of the blade, followed by upward and outward pressure to distract the anterior airway structures away from the view of the vocal cords. People tend to reach for the Miller blade first when intubating kids, in part because they have big floppy epiglottises that aren't displaced as reliably by the indirect forces generated by lifting the Mac blade within the vallecula. Pinning up the epiglottis directly using the Miller blade circumvents this issue. Some people also reach for this blade first in adults as a matter of preference. There is no such thing as a right blade for any given airway, but there is such thing as a wrong blade. Make sure that the blade is appropriately sized for the patient. Beyond that, it's more about the operator's comfort with the blade than it is the blade itself. Learn both and use whatever you're comfortable with. You can see more on DL blade technique from Seth Truger and Min Lakong through the link below.